Nope.
So today we have two speakers, and the first speaker is Stephen Ito. And when I learned about what Stephen is doing at Ohana Pacific Medical, it was like, oh my gosh, boy, do we need you. So I'm really glad that it worked out that Stephen is able to present to us today about the amazing work that he's doing. But just a short little bio first. He was born and raised on Oahu, and his family's been here for 4 generations, originally from Maui. And he came back here after his medical training in 2015 to be closer to his parents and his family. And he is currently the CEO of Ohana Pacific Medical, which he's going to tell us about today. And his training is in family medicine, and clinical experiences in the urgent care setting led to his passion in specializing in home visit based programs for Kupuna. He loves going to the beach, surfing, playing ukulele and football. And of course, he loves his family, wife, son, and daughter. So, Stephen, we're going to turn it over to you. And thank you very much for presenting today.
Oh, thank you very much, Jen. It's a pleasure to be here. Thank you all so much for having me. Really excited for opportunity to share with you all what we're doing here with Ohana Pacific. So we are Ohana Pacific Medical. Our catchphrase here we like to throw is we're a medical clinic in your home. And we started a few years ago. We're a relatively new company. We started in 2019, and we deliver healthcare to patients. There was a trend in healthcare, primary care especially, right? Before pandemic, long wait times, waiting rooms, transportation, Hawaii traffic as we know it. And it's these are big barriers in our access to care, especially for our Kupuna. So, we decided to meet this need that I've seen throughout my years of practice. And we decided to create the Kupuna program, which is the centerpiece of our services. And we deliver providers and medical staff to patients directly in their home. The pandemic hit, so that was definitely a bit of a challenge. We just opened up our doors. And when the pandemic hit, we were really everyone was caught off guard, but luckily for us, we were already utilizing cutting edge technologies like telemedicine before the pandemic. And we're providing this home visit model. And so our mission, which is to enhance and kind of serve the wellness for all Kupuna, was really put on the spotlight and tested during the pandemic. And we did continually open our doors during the pandemic. We did not, well, except for March when the whole nation was shut down. We still continued medical home visits for our patients, even during the pandemic. We gave access to telemed to a lot of Kupuna who were unable to access their doctors because of the pandemic. And we were really providing so much access to Kupuna all over the island. And it was really amazing to kind of see everything kind of rally towards what we were trying to do. And we were very grateful for the opportunity and the timing of things during such an unfortunate thing such as the COVID pandemic. Our services are really simple. We provide medical home visits. We provide a lot of telemedicine even prior to the pandemic, and which allows a lot of access to care to all types of patients across the continuum. We also have a mobile lab draw service that I'll touch base on a little bit later. And urgent medical visits. We strive to prioritize and give our Kupuna urgently time available for them to be seen by our medical staff and providers. And that's really key part of this service is to provide urgent access. Our centerpiece is the Kupuna program, and we have a home visitation program where we do face-to-face visits in all settings. So residential homes, foster homes, we go to facilities on the island, like assisted living facilities and whatnot. And the first patient encounter is always a face-to-face visit with our team. So whether it's in the home, which a lot of it is, or in the office, we try to make an effort to accommodate our clients, our patients and their families, and to make sure that that first visit is always face-to-face. We have our mobile lab services that also provide that patient-centered care, where even though it's not covered by insurance, which is something I wish it was, we provide access at the home where patients can get mobile lab draws for phlebotomy, also for TB skin testing as well. During the pandemic, especially, our mobile lab services were especially critical as we were one of the approved sites to do mobile PCR testing and rapid COVID testing. We had a drive-by setup. We had mobile phlebotomists who would go out and draw PCRs and do rapid tests and whatnot. And it was amazing. It was a really crucial piece to our program during the pandemic for a lot of our kupuna. Urgent medical visits, telemedicine has been something that I always saw as a real big part of our future medicine because it provides so much access to care. And the pandemic heightened that even more so. And so using technologies that are HIPAA compliant or secure are now the commonplace. Before the pandemic, I could only name a couple or a few of them that had that HIPAA compliant capability. But now, there's Zoom that's HIPAA compliant, which is amazing. And there's a lot of other different vehicles, but telemedicine really allows us to give those patients the same day access. We also offer a lot of primary care services as well, not just geriatric care, but we specialize in geriatric primary care. So a good part of our patients, of course, have Medicare, and we're in network with most health insurance plans like HMSA's Akamai Advantage, MDX, Humana, United Healthcare. And we're even in network with Aloha Care and Ohana Care and the Quest plans associated with them. And so we really are trying to provide a access to all types of patients, geriatric patients, regardless of their insurance. And one of the great things about our program is that they do not have to switch primary care providers. We do not have to be the patient's primary care doctor in order for them to enroll in our Kupuna program, which is a great plus because a lot of our patients in our Kupuna, they may have a doctor that they've seen for 20, 30 years and they would like to keep them and they do a great job. Well, our job is to help the patient and that doctor and their team of specialists to continue what they do best and to be that kind of safety net. And so, having that collaborative care is a big part of our Kupuna program. How does it work? So it's really quite simple. Like any doctor's office, you contact our medical team to enroll. And from there, what we do is we have our onboarding consent packet that allows us to bring you on board. And from there, we try to schedule your first visit. And as I mentioned before, that first visit will be face-to-face. It will be a home visit if you're in a residential home or if you're in a facility. And for some of those patients who prefer to come and check out our offices, they can come up to our clinic as well. But that first visit, many of our kupuna, they definitely prefer the home visit, as you can imagine. Once they do sign up, there's many services we can provide, for our patients. Of course, acute and chronic illnesses are very common. Falls, urinary tract infections, rashes, dementia, of course, one of them, managing their hypertension or diabetes or congestive heart failure. These are just a few examples of things that we do. Refilling medications has been a huge thing, actually, especially with the pandemic. And a lot of patients we've seen have opted into a lot of these delivery mail order pharmacies, which has been very convenient, especially during the pandemic. I know a variety of new ones, especially Mark Cuman's Cost Plus, which has been a godsend as far as how cheap he's able to get some of these medications refilled. Referral for specialists, whether they need to see a cardiologist, a physical therapist, speech therapist and whatnot, we can help them with all these things. For some of our patients who are moving from one setting to another, maybe they're moving from their private home or they're moving from facility to facility, do we need an annual physical? They need their TB skin testing done and maybe some labs. And so these are just a few examples of things that we can provide for patients who are transferring from one care setting to another. And also equally important is filling in missing orders or doing a medication reconciliation. So that is highly recommended because polypharmacy is just one of these things with our geriatric clients that can be a huge barrier. And it's very complicated. Medications are not simple. There's a laundry list of them. And filtering through these and conducting a proper reconciliation to determine Are there drug interactions? Are there duplicates? Are there things that need to be thinned out? It's very important for a geriatric population. Our process, as I said, it's patient-centered. We like to think of it as community-based care. And, there are different names for that thrown around, but at the core, we are a community-based model, and it's a patient-centered model. And what we do is all centered around the patient. So providing those medical home visits for our patients on the island, giving them urgent access through our telemed consultations, providing mobile services for the clients so that they can get timely diagnostics completed for their healthcare team to be able to help them. And of course, having a ability to provide not just primary care, but geriatric primary care, and a specialty of healthcare team members who really just are driven and really trained and focused for our kupuna and that population. And that's the summary of really everything that we do here. We definitely are a relatively newer practice, and we're hoping that we continue to provide a great job and service to all the kupuna on the island. And thank you guys so much for having me. I tried to keep that under 15 minutes as much as I could. I think I might went a little over, but that's Ohana Pacific Medical. Thank you guys all for letting me to share.
Well, thank you so much, Stephen. So if people are now thinking, wow, my mom needs this, or I have clients or patients, again, what is the best thing to do is to write to you guys directly?
Right. They can give us a call at our number. I can put it up. I should have left it up there.
I think you should have left it up there.
Let me put that contact one back up. But yeah, they can give us a call. Right here is our contact number. And basically, they can go ahead and let us know, hey, I have my so-and-so loved one or uncle or whatnot, and I'd like to get them enrolled, and we'll take it from there.
Okay, that sounds good. Although you need to make this more senior friendly, it may be too small for people. So there was a question about, do you use TRICARE?
Yes, we do accept TRICARE. I know there's two different types of TRICARE. There's like a TRICARE West, which I believe is the one we take. There's like a TRICARE for life that's like a HMO. So if you have the one type of TRICARE plan where you can see any doctor on the island, that's the one that we have, because we're not the VA or those doctors, tripler doctors. Yeah. And same goes with Kaiser as well. We're not Kaiser doctors, or Kaiser clinic, so we cannot accept Kaiser as well. We do offer a cash pay service to be enrolled, but I guess I'm a softie. I really don't like to do that because I hate to charge Kupuna for something that is covered through all these other medical insurances. But there is a need, and we do offer a cash pay for some of those Kaiser patients who are unable to join. Yeah.
Well, I also appreciate your honesty of, no need to charge people for things where they could get it somewhere else.
Right.
Dana asks about your hours of operation.
Mm-hmm. So right now we are Monday through Friday. However, we have, if you are in our program and we are monitoring your health, we have Saturdays, half-day Saturdays, where we have access to our Kupuna team. And currently we are working on outsourcing some staff to give that support so that it's 24/7. So that's why we're revamping later, Jen. We have a lot of things down the pipeline that we want to kind of, put out there. And once it lined up, we'll definitely have you all notified. Yeah.
Oh, great.
Yeah. Jeanette, I just want to put in my 2 cents, because I worked with Stephen for many years, and we have clients. I have clients that have become his patients, and it has been just a fantastic, working relationship, and our clients love him. So
thank you, Lori.
can't say enough about Stephen.
Yeah, and I
Thank you so much.
apologize. I should have said, Stephen, we learned about Stephen through Lori. So Lori did the vetting. So we trust Lori, of course. And I will tell you, Stephen, I've already sent a couple of people your way. So a lot of people are looking for, for this sort of support and services that you offer. So thank you. And thank you, Lori, for starting us on this collaboration. So there's another question here. Do you coordinate with Project Dana or Hawaii Health and Harm Reduction Center, who do outreach to shut-in elderly and mobile wound care for homeless people?
Oh, I see. Okay. I know about Project Dana, and I also am aware about some of the IHS and whatnot, and I do know some physicians there. We don't offer wound care. We don't have RNs on staff that do that home health kind of a wound care. But that is something that we're open to. If there are patients who are geriatrics and they need our services, we're happy to try to find a way to collaborate. Definitely. But short answer, no, but we're happy to collaborate with them.
Great. So I don't see any more questions, but I will, okay. I think you've shared your contact information here so people know how to find you. And, again, as you do your rebrand and other information, let us know so we can share that in our personal and professional network. So we really appreciate that.
Awesome. Thank you so much for having me, Jay. I really appreciate it. Thank you, Laurie. Thank you, Hope. You guys, I really appreciate your time and everyone's time for joining. Thank you, guys.
Oh, wait, there's one more question.
Oh.
Mobile care, do you do chest x-rays?
We don't have radiology mobile, but there are companies like that do mobile that we can order it from.
Yeah, it sounds like you guys have thought about a lot of these things, so that's good. Is there a referral packet or just call?
Yeah, there's both actually. So for like community partners, we set up like a kind of like an intake system so that it's streamlined. You have a point of contact that's responsible. So if you send someone to us through secure email, fax, or whatnot, you got one contact person to streamline things for you. And we do have our consent packets that also can be distributed to our community partners who would like to help refer patients. Yeah.
Okay, good. Well, thank you so much again. Thanks for coming.